Thank you, Mr. Slavitt. Commissioner Koskinen and Ms. Slavitt, I want to return to the theme I mentioned in my opening statement, and that's trust. I think that, my view, the American people has lost trust in the IRS for a number of reasons, including health care. And I think the disastrous rollout of healthcare.gov has created a lack of trust among the American people, as well as promises not kept. I do appreciate the work, Mr. Slavitt, you're doing, and there's a lot of it, to try to bring that, that site up to speed. More importantly, making sure we get the back end completed and right. Problems obviously remain with this. There are going to be more problems going forward into the second year. So my question to both of you, and it really isn't a gotcha question, but in spite of all these problems, you know, how do you expect to again regain the trust of the American people when it comes to their health care? The ACA, my view, through heavy subsidies is reducing the cost for some, but is increasing the cost for others. And there's real concern back home from patients, providers, businesses about the Affordable Care Act. So what are you doing to make sure the second year of the ACA is not like the first year, and that steps will be taken to regain the trust of American people, regardless of what party they are, that are just simply concerned about their health care? Commissioner?
Well, we take, as I hope everyone knows, seriously the obligation to, as I say, try to make it as clear and straightforward and as easy as possible for people to determine what they owe and to be able to make those payments. As I've said on numerous occasions, we distinguish between the willing to pay and the unwilling to pay. And those willing to pay, even if they have difficulties, as I've said, don't have to hire somebody off late-night TV to come talk to the IRS. If you're willing to pay, trying to become compliant, we are anxious to work with you. We have installment agreement possibilities. We have ways of creating offers in compromise. With a focus on ACA, our role in the front-end rollout of providing income verification data went very smoothly. Inspector General said that it was virtually perfect. But we understand that there are going to be challenges with the first filing season, and that's why we're spending as much time as we are starting last spring trying to explain to the American public how the ACA affects them and what they need to do for filing. And as I said, one of the most important things for the public to understand is the vast majority of those filing next year, out of the 150 million expected individual returns, 120, 125 million of them will simply check a box that they have coverage, and that's all they'll have to do. The other people filing, those who either reconciling premium tax credits, seeking a credit, filing an exemption, or dealing with the shared individual responsibility payment, will have additional responsibilities when they file, and we're doing everything we can to get them that information. We've had tax preparer forums across the country with 10,000 tax preparers with focus on ACA. But we take very seriously that, again, compliance with the Internal Revenue Code is a critical part of the tax system in the United States. We have a very compliant population. Our compliance rate is one of among the highest in the world. But to maintain that compliance rate, your point is well taken. People have to have trust and confidence in the system. They have to be confident they're going to get treated fairly no matter who they are. As I've said, one of my highest priorities is to try to make sure that people understand from when they hear from the IRS, it's not because of who they are, what organization they belong to, who they voted for in the last election. If they hear from us, it's about an issue in their tax return. And if somebody else had that issue, they'd hear from us as well.
Well, there is questions about that, but let me ask this. IRS has three main tasks right now related to this. One is to confirm income verification of those who are getting subsidies today. Secondly, on January, delivering to American people Form 1095A that tells them what they need to do to file their taxes. And then to have income verification in place before the second year premiums and subsidies are released. Where are you on each of those three?
As I noted, last year in the rollout, we provided income verification information to 27 million inquiries. The Inspector General reviewed it and said we were 100% accurate on the information we provided. It was primarily information about tax return information for 2012.
Of those you had the information for, but a million of them, roughly, the Inspector General said roughly a million of them had inconsistencies, were not complete applications. what's
that was his review of the of HHS's and CMS's rollout. But in terms of the information provided by the IRS, the Inspector General found that 100% of it was accurate. It was accurate to the 2 years.
So all the income, from the IRS standpoint, everyone who's receiving a subsidy today, their income has been fully verified.
Our role is to provide the data when the inquiry is made. We don't play a role in terms of what they do with the data. We will have a significant role when people file.
But the IRS has the role of income verification.
When they file, we will obviously verify income as we do for the 150 million people who file, and that will determine the calculation that the taxpayer makes, will determine whether they're eligible for the premium credit, how much of the advance payment they got, and what reconciliation they have to make. So
again, today, of those receiving subsidies through the ACA that are helping them with their health care, the IRS says, you can assure us all of those incomes have been verified at this time.
We've provided income verification when requested last year in the rollout. We'll do it again in this year's rollout. We have been advising taxpayers since last spring that whatever determination they made with the marketplaces about their circumstances, if there's any change in those circumstances, either in their family size or their income, they need to go back to the marketplace, because our concern is that everybody makes an estimate when you file your W-2s and you're withholding. Sure. You're estimating what your income will be. Obviously, for most people, it changes to some extent.
Sure.
So we are focused on and concerned that we don't want people to have either gotten too small an advance payment or too large of an advance payment.
What I didn't hear was a yes there. And I'm hopeful we can get the day where you can say, yes, we have verified them. The 1095A, due in January, have you completed testing on that? Can the American public be assured when they're ready to do their taxes and get their refunds that that form will be there in January?
Right. We don't provide that form. That form is provided by the marketplace.
But you provide the information.
Happy to turn it over to my colleague.
Okay. Okay. How about preventing income verification to prevent ineligible subsidies in the future?
As I say, in this rollout period for the second year, we'll continue to provide income information to assist the marketplaces in determine eligibility. But I would stress, in the filing season, we will check, as we always do, with everybody who files, their income will be verified. They have to, as I say, we have a very compliant population. They provide information about their income as it actually happened. What we're providing in the rollout is income information that can be used for verification for a previous tax year. But again, that's what in this year's rollout, it'll be what your tax income information was for 2013, but it'll be used for eligibility for 2015. And again, when you file for your 2015 taxes, you'll have a different number almost no matter who you are, sure, as opposed to what you estimated.
What is the process for collecting overpaid subsidies to those who are not eligible? Do you have that process in place?
That process will be our normal process in the sense that to the extent that your subsidy was too small, you will get a credit for that. For a lot of people in this income range, it will be a refund. To the extent that your advance payment was too large, there will be a deduction either from your refund or an increase in the tax owing.
Sure. No, I know how that process works. Is it in place to do that?
We are
fully in place to do that.
It is, at this point, we're about to test our own systems, but I'm assured I've been meeting every 2 weeks since January with the IT people, with the program people, and the business people, looking at exactly what we have to do to make that happen. And thus far, I've been assured that while it's a challenge, we are on track to be able to do that.
Sure. For someone who, through no fault of their own, received a subsidy they weren't eligible for, about what month in next year will they get the bad news that they owe taxes back to Uncle Sam?
They'll get that news whenever, shortly after.
That would be bad news. They'll get that news.
They'll get that news when they file in the normal course. In other words, that news will be no different than any other bad news you might get if you turn out to owe taxes. So you'll file a return. It will you'll actually make your own calculation off the 1095 you get. You'll determine whether you got too much and you owe additional tax or have a smaller refund. You'll make that determination and you'll file it with your return. Some people file in January, some people file in April, and obviously some extend their return into
so they may start the repayment as early as January of the coming year?
It will all depend when they file.
Sure. Commissioner, or Mr. Slavitt, can you address the issue again? I know the serious work you are doing, both to address the problems in the past and try to both get the site working right and the back end right. There's no question about that seriousness. Can you address the trust issue at this point?
Mr. Chairman, thank you for the question. I've actually thought a little bit about this question. As I mentioned, I've worked for the government for 2 months, and interestingly,
you're an old hand.
I'm an old hand. Well, interestingly, the people that I've worked with at CMS and at the department and across the government, you know, the career people have been some of the most trustworthy people I've ever worked with. Yet, as coming from the private sector, as you said, there is a trust gap, and you know, the way I understand that trust gap to be closed is the following ways. One is with transparency. Even when the news is bad, we need to be clear about what that news is. And I think this summer you've seen we've put out numbers, even worst case numbers, when there are challenges to help people with inconsistencies and so forth, rather putting those numbers out than other numbers, waiting for them to get better. Second is accountability. That means being here, and my first several months I've been here frequently as I need to be. It also means owning up to mistakes. I don't think people expect us to be perfect. I do think people expect us to fix things when they don't work and be very candid about them and be very accountable. And the third is straight talk. As much as possible, that means giving a direct and clear response when people are asking us very fair questions. It means saying, I don't know, when we don't know, even when we want to struggle to get back to people. There's no question that this implementation has a lot of pieces. It requires a lot of cooperation, and I think we can gain trust, I believe, in the work we're doing across government if we're clear in those categories.
Thank you, Mr. Slavitt. Again, I think you're trying to implement a poorly designed, poorly written, unworkable law. Nonetheless, I think that approach of openness and transparency and straight talk will go a long way, frankly, toward restoring that trust. So thank you very much. Dr. McDermott?